I'm going to have you do is just start from this side over here, introduce you, just give me your first name and who you are with.
I'm Beth, and my partner, my husband, is Roger.
And where are you from?
We're from Harrow, Ontario.
Harrow, very good. Young lady?
And I'm Barb, also from Harrow, Ontario, and here with my husband, Paul.
Okay, so Barb, let's start with you. Since two of you had care, but I want everybody to just participate and tell what happened with you, but also, you know, the husbands, the spouses can also just share also what you've noticed as well. So go ahead and tell us what happened. What kind of problems were you having when you came in? What was going on with your life?
My life wasn't so good at that point, really. Actually, my life, I'm 60 years old. All of my major joints are pretty well full of osteoarthritis. So I was scheduled for a knee scope that actually would have been taking place tomorrow, actually. I needed a knee replacement, but was told too young. Couldn't move my shoulder and my neck because of the arthritis in my shoulder. My lower back, I wasn't able to bend. So I didn't really like the options because I've had really bad history of some not so favorable foot surgeries. So was a little nervous to even comprehend knee surgery, and really was faced with thinking I'd go from knee to knee to hip to hip to hand and be the bionic woman and still have arthritis pain. So was interested to try a healthy new alternative.
So when you say you were interested in trying this, though, what was your thought on this? Like you saw the talk, you came to the talk. What were you thinking?
I saw the talk, and I think I was to a point in my life, and the amount of pain I was in needed to be hopeful, but have to admit I was very apprehensive, thinking it was too good to be true. Really didn't think my life could get better without medical intervention.
Drugs. Drugs.
I mean, I had tried all of that. I had done
Tried the drugs?
I'd done the physio, and I was on, medication, and I have a slight kidney disease as well, of which I'm actually very excited to find out if that will also benefit that. So I'm pretty excited to follow that path as well.
So what were the problems you were having in your daily life as a result of this? What were things you couldn't do? I
couldn't really walk anymore. I used to walk, we have to pick our mail up at a post office. I used to walk pretty regularly. It was never an issue for me to do a 5K walk, or to do a 2K for sure. It was never an issue. I had gotten to the point that I couldn't do that without pushing probably the stroller of our grandkids. And even at that, our last little, we do some charity walkathons, and I couldn't even do that, even pushing the stroller with the pain. I couldn't go really up and down stairs. Getting up and down, I couldn't get into, I was to a point with the arthritis in my shoulder as well as my knees, I couldn't get in and out of a bathtub. I now am here 5 weeks later and I'm getting in and out of a bathtub. I'm going up and down stairs.
What about your even outlook on life?
Oh, my outlook on life is just second to none. Like, I really was to a point that I'm thinking, okay, well, I want everybody to know I'm happy with my life. I've had a great life. And I'm okay. And here I am. Thrilled to be alive. Before, I was like,
feeling good. Mm-hmm. Yeah, you were satisfied. You were satisfied you had lived a good life, and that you were satisfied that good life was basically behind you. And now you're after me, where are we going next on a trip?
yeah.
Yeah, there you go.
So, it doesn't stop with the cost of the stem cells. It's going to continue. Because now you've got a more positive outlook on life.
I now feel like there's life again.